Welcome back. This week is Influenza Vaccination Week. Here to talk about the importance of getting your vaccine is infectious disease specialist Dr. Jaime Catala. Thank you so much for being with us, doctor. All right, you and I were just talking about the flu.
Yes.
It's here. It lasts until what we say, like March? Okay, so the height of the season, just around the holidays and after. But I'll tell you, I was at the pediatrician with my daughter yesterday, and she said, I'm back at it, swabbing everybody. It seems like it's around right now. So what are you seeing in your office?
So what we normally see is that this is a time where a lot of common viruses where it's going to be attacking everyone. So we're seeing a lot of sneezing, a lot of cough, a lot of sore throat. And those are a little bit kind of complicated because you cannot distinguish easy between one virus and the other. So you have to kind of know or be inclined towards one symptom or the other so you can differentiate what the patient could have.
So some people are spot on. Every year they get their flu vaccine, but some people don't. There's a lot of misconceptions, I feel like, when it comes to the flu vaccine.
Yes.
You always hear one of them that says, every time I get the flu vaccine, I always get the flu. What do you say to that?
So when you get the vaccine, you can have a reaction to the vaccine, and it could be normally pain where you get the shot. It can be redness. Some people can have some fever. But the reason that you're having those symptoms is most likely because you're getting a new fluid in your body and your body's doing this reaction. But it's not the flu or the influenza by itself. It takes around 2 weeks to make antibodies, but what you can have is in those 2 weeks, you could potentially be infected with the influenza, and you could have the symptoms of influenza, but it's not because of the vaccine.
And you made a really good point about 2 weeks for it to start to be effective, right? For you to make those antibodies, which I was just looking at the calendar today. We are a little over 2 weeks away from Christmas when you're going to be around all your family and friends. So now is the time. It's not too late to get it.
It's not too late, actually. The peak season, especially here in Florida, is January and February. So I will advise everyone, please get your shots, especially if you're going to be close to your family, if you're going to be surrounded with friends. So that way you can prevent having these little outbreaks or family gathering that everyone gets sick. Yes.
And I know each year they try to target what the flu is going to look like, and they really try to taper the vaccine. How have they done this year? Does it seem to be pretty effective?
So the vaccine is pretty effective. It decreased 50% of hospitalizations. So that's something big. Very big. Especially if you are someone older than 65, that you have morbid conditions, you're pregnant. So those conditions could make you more prone to have a severe infection. So yes, it's effective. You can reduce 50% of hospitalization. Also, it has 40 to 60% of efficacy that you will not have illness symptoms, or you can have mild symptoms if you get infection.
It reduces them a little bit. Really good information. Doctor, thank you so much. If you would like to learn more about the vaccination and what's going on this week, we've put a link to their website on ours on WPBF.com. Just search influenza. Thank you so much. Good information.